So plastic surgeons woke up to an email this morning from our two major plastic surgery organizations, and it is a consensus statement about breast implant capsulectomy definitions and management. So this statement is from the breast surgery collaborative community. So this is a community that is comprised of advocates, layperson advocates, as well as board certified plastic surgeons who are representative of a majority of different groups. And they also invite the FDA and the device makers to be part of this collaborative so we can all come together, look at the data, and come up with the best plans for our patients that are evidence-based. So the first thing in this statement is that they want proper definitions for capsulectomy to be used. So in the breast implant illness community, there are doctors that utilize the term en bloc capsulectomy, and this is not the proper terminology for a surgery that they are doing. So they recommend that we use proper terminology when we're discussing publicly with patients and also privately with patients the surgery that we're doing for them. They also say in this statement that en bloc capsulectomy, which is removal of the breast implant capsule along with an uninvolved margin of tissue, should only be used with patients that have suspected or confirmed cancers of the capsule surrounding the implant. So not for breast implant illness. The statement includes this quote from Scott Glassberg, who is the current president of PSF, which is a not-for-profit that funds plastic surgery research. And he says it's unfortunate, but there are surgeons who will capitalize on a patient's trust or fear and urge them towards a more costly and riskier procedure. We've been seeing, unfortunately, that there's a group of surgeons that the community holds in high regard who are discounting research and recommending procedures inappropriately to patients. I think it's great that our societies are coming together to stop these surgeons from harming patients and convincing them to have unnecessary surgery. So ladies, if you have symptoms from your breast implants and you're pursuing implant removal, you deserve an accurate evidence-based plan, just like every other patient with every other medical problem. You need to be holding these doctors that are recommended by the BII community to a higher standard. They should be able to tell you why they recommend what they recommend. And if they're recommending removal of the capsule, they are recommending something that has been shown in multiple studies not to help you, and they should tell you why. And spoiler alert, it's because their entire practice stems on doing one procedure and profiting off of your fear. So please, ask more questions and ask them of these doctors too. A lot of you guys show up on my posts, ask me questions, grill me on what my recommendations are. You need to be grilling these doctors too.